Hello. In this video, I want to explore a little bit of truths concerning 4 atypical antipsychotics. And those antipsychotics are Abilify, Zyprexa, Seroquel, and Risperdal. I have an abstract here of a study that came out of the University of California, San Diego School of Medicine. They worked with Stanford University and the University of Iowa. It's funded by the National Institute of Mental Health. This study was released, it was a 5-year study. It was released November 27th of 2012. Hit all the major publications, the results of the study. And the results of the study are really just outstandingly bad. So bad. They found that these atypical antipsychotics which have been pushed on our children, our people in the nursing homes, now people with mood disorders are given to people just for sleep. I mean, they're just so wide. They're distributed about like M&Ms would be at Halloween. But this is scarier than Halloween, because this is really happening. And the truth is that the 4 antipsychotics were found to lack effectiveness in a big way and had a high incidence of side effects. The actual statistics were, in the first 12 months of the study, 36.5% of the people given these, and nobody got a placebo, everybody got one of these medications, 36.5% developed metabolic syndrome. 23.7% had a serious adverse event, and 50.8% had a non-serious adverse event. Seroquel, which is what we're prescribed so much here in the state of Tennessee, and it's one of the best-selling drugs in the nation. Seroquel produced such bad results, they pulled it halfway through the study. They quit even offering it to anybody. Informed consent. Informed consent. If people were given the truth, informed consent, a lot of people would say, no, thank you. I'll work on my sleep with maybe a bright light therapy or some melatonin, or maybe try some other, get some sleep techniques. Here's what informed consent consists of. And this is supposed to be given by the doctor, not by some nurse or some tech on a unit. The patient's diagnosis, the patient's prognosis, the proposed recommended treatment, the risks and benefits associated with the proposed recommended treatment, alternative treatments, which alternatives is a dirty word in the state of Tennessee, the risk and benefits of alternative treatments, and the risk of foregoing treatment should the patient refuse. This is not being done. Very rarely. I doubt if 2 people out of 100 get proper informed consent in the state of Tennessee when they go in for help from a psychiatrist. November of 2011, this was in our paper, Associated Press article. Day after day, Hazel Ing sat on her couch, a blank stare on her face. She's in a nursing home, by the way. The powerful antipsychotics she was taking often cloaked her in sedation. And when they didn't, the 89-year-old lashed out at her nursing home's aides with such anger and frequency that her daughter wondered if her mother would be better off dead. She's in a nursing home. Until, in a matter of days, everything seemed to change. Ing's daughter, Jean Lynch, says her mother was moved to a different section of the Euchman home in North Branch, Minnesota, and taken off every drug but her daily aspirin. She now beams as she ambles the hallways, reads the newspapers, tells stories, and constantly laughs. Now I hope she lives till she's 200 years old, Lynch said. These antipsychotics are being given to our elderly, tripling their incidence, their chance for stroke or heart attack. Basically, you're killing them with it, just to make it easier to deal with them in the nursing homes, when what they need is love and attention, maybe a hot towel draped around their neck, a massage. Maybe here's a novel concept. What about maybe talking to them? Yeah, right. There's no money in those things, see? That's why they're doped up, for the benefit mainly. Now here's the truth. Get your umbrella out. It's going to rain some cold hard truths here. And it just already is. I hope you can handle it, because some of you have your relatives on these medications for possibly your benefit. And you know who I'm talking to there. The California Department of Public Health, California, a lot more progressive than here in Tennessee, they did a study on the antipsychotics in the nursing homes. And I'll be glad to send this link to anybody that wants to email me. They found that basically people's being put on them without informed consent. They're being harmed by them. The pharmacists were not even notifying anybody that's about the black box warning for them. And by the way, this study that I'm speaking of, it was in people 40 years and older. These same drugs are given off-label. These same 4 atypical antipsychotics are given off-label to children, especially if the children are in foster care, or here in Tennessee, all children that don't have parents with money or great insurance on their own through where their parents work are put on Medicaid. And most of the time they end up on these if they act out. They get to squirming too much in their seat at school, and then they end up on Seroquel, and then they wonder why they can't get up and go to school. Okay, this I think is just a travesty. These studies are hard to read. I didn't even buy the whole study. I'm just looking at the abstract from the study. But the conclusions were, and this in 332 people and over a 5-year period, the conclusions: employing a study design that closely mimicked clinical practice. That's layman terms for the same thing as happened to people when they go see their psychiatrist. We found a lack of effectiveness and a high incidence of side effects with 4 commonly prescribed atypical antipsychotics across diagnostic groups in patients over age 40, with relatively few differences among the drugs. Caution in the use of these drugs is warranted in middle-aged and older patients. They've never did a study as to what it's doing to the children. So it drives your cholesterol numbers up. It sets you up for diabetes. It causes tremendous weight gain. It messes with your blood pressure. In so many, 36% of the cases develop metabolic syndrome, basically a precursor, is my understanding, of type 2 diabetes. So, what's the truth? What's the truth about these antipsychotics? When you see them advertised on TV, well, you're antidepressant, not quite doing it. You wanna feel a little bit better? Maybe you should try Abilify. Well, do you really want to try it? Do you really want to go there? Has anybody ever told you? Have you owned any of these antipsychotics? We're just talking about one class of drugs now, the antipsychotics. Has anybody ever told you the dangers? Do you have the strength, the capability of finding out for yourself? Maybe Google the antipsychotic you're on. Do a little research. And stay tuned, because we're going to We're going to address a lot more truths going forward at Psych Truth Seekers. Have a good day.